As federal health officials try to warn us about a potential fourth wave of this pandemic, they're also sounding the alarm about younger people having severe cases of COVID-19. COVID-19 specialist Amanda Decker here now with a look at the numbers and what may be playing a role in the surge.
We could be entering the fourth wave of the COVID-19 pandemic, but this time it may be impacting children and younger adults more than older adults. Before now, much of the concern has surrounded older Americans contracting COVID-19 due to the high risk of severe symptoms and death. 80.9% of all COVID-related deaths in the country have been among those 65 or older. But now that trend in the country is starting to shift. A new surge of people in their 30s and 40s being hospitalized with severe COVID-19 infections. Dr. Rochelle Walensky, head of the Centers for Disease Control and Prevention, says the variants and the vaccines are part of the problem. Now, the UK variant is now the dominant strain in the US, and both the Brazilian and South African strains, as well as several others that have originated here in the US, are spreading rapidly. Over the past week, almost 60% of all new cases in the country were the UK variant. That's 67% more contagious and 60% more deadly than the original strain that circulated nationwide. Roughly 3 million COVID-19 vaccine doses have been administered daily across the country in the last week, but many states still have not opened up eligibility to all adults. While more than 57% of people 65 or older are fully vaccinated, only 25% of people 18 to 64 are. Now, the advice from experts, as soon as you can get those shots, get them, because these factors combined with states and municipalities dropping restrictions and many of us letting our guards down mean the next surge could look much different than the ones we've already seen. I'm COVID-19 specialist Amanda Decker reporting.